So our last presentation is called Not Okay, Bringing Awareness to Older Women in Domestic Violence Shelter. We are pleased to have Donna Jean Forster, who is Executive Director of Optimism Place Women's Shelter and Support Services in Stratford, Ontario, joining us today. He has been the executive director in a variety of sectors for over 30 years, but the last decade, she has been leading the violence against women sector. She champions collective impact as a multi-sector approach to creating change in our communities and deeply believes that we can make a difference if we work together, which I think has been a common theme throughout the day. So I'm looking forward to learning more about the work that you're doing and your campaign that you have that's happening right now. So I'll turn it over to you. Thank you for coming.
Thank you for having me. Just let me know that you can see this.
You just have to put it into from
Yeah,
the beginning. Yep.
great.
No,
Well, thank you.
it's no, sorry, it's still in. You just have to click from the beginning, I think.
Can you see it now?
I still see the slideshow. Do you have two screens?
Oh, hang on. Yeah,
It's
let's better.
coming. There you go. Perfect. Thank you.
Thank you. Sorry about that. Thank you for having me. I'm going to chat with you today and try not to go too fast, knowing that you're probably wanting to. I'm standing between you and the end of the day. So I'm going to chat about our experience here at Optimism Place Women's Shelter and Support Services, serving seniors in our shelter, as well as our awareness campaign and our multi-agency risk assessment table and how that table is serving seniors. I thought I would start today with just a little bit about Optimism Place. We have existed here in Stratford, Ontario, serving women and children across Perth County for the last 43 years. We operate a 24-hour support phone line. We have a 29-bed emergency shelter and residential program. We also do a coordinated community high-risk response, and we have community-based wraparound supports that is legal and family court support, housing and income supports, group counseling, community connections and resources. And as an organization, we're very committed to community and workplace gender-based violence and intimate partner violence training and education, and working closely with our collaborative partners to really make a difference in our community. Oops. I think it's nice that I'm following the Wildflower Way. There is a lot of things that you will hear that dovetail nicely with that last presentation. But first, I wanted to root our conversation in a story. This is Maureen. Maureen is a resilient, wise, witty, determined woman who landed on our shelter doorstep just over a year ago. At 75 years old, she had experienced a lifetime of abuse and control, for sure the last 60 plus years. She has not really interacted with community-based services, and really has experienced over the course of her lifetime substantial isolation from family and friends. She has no personal bank account, limited financial knowledge. She was experiencing cognitive and physical impairments due to abuse and also age. And because she landed on our shelter doorstep, she's also homeless with no access to her family home of 40 plus years. And coupled with that, Maureen was really not used to being cared for or really considered that anybody could care about her. She didn't have hobbies, no family doctor, and on top of that, she's really funny. And she gave me permission to share her story with you today. We are still involved with her quite intensely with her life. And I would say for us, she really started to kick off a trend. Our organization in the last 43 years, over the course of those 4 decades, Probably seeing a woman in our shelter or in our programs over 60 happened fairly infrequently. But there is a trend happening that this is happening more and more. And for us, in recent time, Maureen was kind of what started the trend and helped us really look at our service delivery practice and what are some of the implications of having older women who are residing in our shelter. When we looked at the last 3 years, so 2023 to 24, 24, 25, and 25 to just this January, so not a full year, within our shelter program, we've had 1,000% increase in the number of women who are staying in shelter who are over 60 years of age. Um, and on our community-based programs, we've had a 900% increase in the number of women who are accessing those programs. If we looked at the numbers back and included women who are 55 plus, we would add 72% more women to these numbers. And so it is definitely an increasing trend, and we are very mindful about our service delivery as a result. I thought I would just share some of the characteristics of the older women that we're serving. We've seen this across all of the older women that we have encountered in our shelter and our community-based programs. The big one has been isolation and estrangement from their adult children in particular, as well as their extended family. And that has significant implications for women in our community. Um, because those family members are really the ones who provide additional supports. Our social systems are built on that. And there's a host of reasons that they're estranged from their adult children or the extended family, but it is largely rooted in their experience of abuse and violence. They have limited to no friends, hobbies, social activities, community clubs, due to the isolation that they've experienced. We've also noticed that there is an increased vulnerability to scammers, and this is in part rooted in their isolation and loneliness. And they're more vulnerable to scammers, particularly through social media and through their cell phones for those that are using them. Women coming to us have limited income or savings, and they have limited financial knowledge. They weren't the partner in their relationship that was handling those details, and so are reaching us at an older age, not knowing these things. They are all very grateful. They certainly come to us with a grateful attitude and are thankful that our services exist. Of course, as we think about serving older women, we do know and see that they have physical limitations, but these aren't limitations due to aging necessarily. They're also due to their experience of abuse. They also have cognitive impairments and limitations, also due to aging, as well as abuse from a lifetime of physical abuse. They've also, we've noticed, have had limited to no access to healthcare across their lifetimes. So they lack a family doctor, they have dental issues, vision challenges, hearing loss, but also coupled with this is a real fear of healthcare and social service providers. Women are fiercely independent. They do not easily ask for help. They have difficulty accepting care and kindness because it hasn't been their experience. And women are also coming to us with deep grief and overwhelm. They are coming to us because a significant event has happened in their lives, and they are faced with the loss of everything, and then really this kind of rapid pace of change because they're learning so many new things. And one of the things that we've also noticed in serving older women is that older women are coming with shame around abuse, aging, and their life experience, whereas women who are younger who we're serving are coming predominantly with guilt. And so this isn't an exhaustive list, but this has been in our recent experience. Sorry. There is some systemic challenges. One of these is the social service systems. So these systems are built on the assumption that there is supportive family members who can help step in and fill the gaps. Most of the women who are coming to us do not have any supportive family members. And so social service systems are really challenging to navigate. And us as an organization are expected to step in and fill the role that family would typically fill. Older women may have never interacted with these systems before. Older women who are experiencing abuse are not used to asking for help. And most social service systems are built on the assumption that the woman knows what she needs and is able to ask for that help. We have found that women in shelter are not prioritized in the healthcare system. So gaining PSW support for women who are staying in shelter is nearly impossible. In Ontario, we have to access Ontario Health at Home. They do assessments that are over the phone, and so they talk to women who say, nope, there's nothing wrong. They have all the things they need, which they do because they're in shelter, and we have 24-hour care available for them, and so then they're not able to access the supports. And the broader question really is around who fills the role of family to support her in the community and system navigation. It is a big gap. The other systemic challenge is around housing, which seems obvious. Many retirement homes or retirement communities are very expensive, and women who are coming to us are not yet ready for long-term care. And things like renting an apartment, we already know it's difficult, is exacerbated when there's an older woman who's in shelter looking for a place to live, who's probably never had to rent an apartment on her own before, and may not have the physical supports to be able to live there alone. All of it is scary and overwhelming. There's also isolation. Many have never lived alone, and they need community and friendships. And for us in a more rural area, it often means that women are moving to a new community, and it's scary to move to a new community at any age. But this is what is happening as older women are coming into shelter. The other systemic challenges around transportation. In rural communities, we face this barrier at any age. Getting where you need to go requires a license and a car or a taxi that's expensive. And women are finding themselves needing to navigate new transportation systems. And many of the women who have come into shelter have lost their driver's license. And so they're also navigating their loss of independence around their not being able to drive anymore. So this has implications for us within our shelter program, but also within our community-based programs. The obvious one is just around accessibility considerations. Our building is fully accessible, but even so, there are things as we've been serving more and more older women that we just didn't notice before. And so some of those accessibility considerations are just ensuring that older women are in rooms with bathrooms and not necessarily needing to share bathrooms. There's grab bars, wide doorways, all of those things, as well as other mobility aids like bed rails, raised toilet seats, that sort of thing. Also, it's a relational service delivery model, and this was discussed in the previous presentation. Older women connect more easily with older staff members, and it's a shift for younger staff members to this relational service delivery model. Women stay longer. They are staying for 6+ months. We have found that women who come into shelter, because they have changed their environment and their stress reduces, that they get sick. And they are sick for a month or two, quite sick, when they come in, just because their bodies are letting go of all of that stress. And so that contributes to, is one of the things that contributes to needing to stay in shelter, which is a short-term stay for a longer period of time. The other piece, the other implication is around family reunification. So because women are coming to us without family supports, or as being estranged from their adult children, potentially for a longer period of time, there needs to be a bit of a detective to find out, who are these people? It is now that the relationship has changed. Are they willing to engage in a new relationship? Do they want to be reunited? And can they be a support to her as she's entering a new chapter in her life? We also have longer period of support upon leaving the shelter, and that can be for a year, up to her entire lifetime. We also have found there's a need for accompaniment to community-based services. Whereas a younger woman might be able to go and engage with a community service on her own, older women need warm introductions, transportation, and support to engage with other services. We've also found that shelter staff are needing to provide PSW type of supports. Doing her laundry, making her meals, assistance with falls, hygiene reminders, showering help, medication monitoring, all of those types of things. The other implication has been around programming in our shelter that's geared for older women. So older women are around and benefit from schedules and routines. And so we've needed to look at what our programming is and really increase our programming hours in order to serve older women here. The other thing is around kind of just physical and health supports, so that we have stocks of incontinence products, mobility aids, kind of ready-to-eat meals, all of these things that would support an older woman with her tasks of daily living. I talked about kind of schedule and routines has been really important for us in our service delivery to older women. And the other piece is around transportation. So we have noticed that older women struggle to take, especially in the winter, getting to public transit is very difficult. And so we more often provide more transportation with taxis due to mobility challenges and just challenges navigating a public transit system. So I thought it would be helpful to just share some of the things that we're doing to address the need of this increasing trend of serving older women. We have providing training for all our staff in understanding the unique needs of older women that is delivered by OneCare, Seniors Mental Health Supports, and the Alzheimer's Society. We have worked to focus on building relational service delivery skills amongst our frontline staff. We've increased our staffing by 1 FTE to be able to provide community-based supports over the long term, not just for older women, but for all our women. We've done an accessibility audit of our residential spaces that is really based on the information that's gained from the older women that we are serving, and we've worked to address any deficits. We've also focused on improving connections and partnerships with organizations serving older adults. And we've been increasing programs and activities within our residential and community-based programs to ensure that we have activities and groups every single day of the week. And we've provided training to staff in the HOPE risk assessment. And so that's kind of our initial thing. As we continue to serve more and more women, we don't see this trend slowing down. We will continue to really be responsive to the needs of women who are in our programs and services. So our Not Okay campaign, just switching gears just slightly, is a campaign that we rolled out at the end of November to our entire community. And it's really focused on raising awareness. While the target audience was our whole community to really learn the signs of abuse and know how to respond appropriately, we did consider older adults as a specific population that we wanted to target. And so this campaign includes print materials and digital materials. All of it is on the itsnotok.ca website. You can find it all there. But to target older people, we had images like this one. This is one of the posters that included older people on it so that people could identify with it. We also placed posters in retirement homes and long-term care throughout our whole county. We had posters with tear-off tabs that have information on the tabs that are placed in hospitals and other healthcare providers, particularly targeting places where women will be alone. And this campaign also, it's a 3 to 5 year awareness campaign. What's next for us is really focusing on providing training for PSWs and other healthcare providers who are going to provide services in seniors' homes so that they can recognize the signs of intimate partner violence and abuse and know exactly what to do about it. And how to address it with her and how to ensure that they are getting the services that they need. The other piece that we are looking forward to in the future is creating discrete cards for healthcare providers to share with women who may present in healthcare provider offices with signs of abuse or may disclose abuse that's happening in homes. Some of the outcomes, this has only been really 3 months that we've been doing this campaign, but we've had really some significant outcomes. We've had a 34% increase in the number of calls to our support line. The website has had 800 visitors since December. I don't know if this is linked to this campaign, but in January, just this January, we had 5 women over 55 who were residing in our shelter and engaging in our residential program. And that's the most older women we've had in a shelter at one time. We've also noticed that we've had a substantial number of older adults who are reaching out to volunteer, who are delivering campaign materials to workplaces and businesses all across the county. And we've got more than 25 retirement and long-term care homes that have posted campaign materials. And we are providing training for hospice volunteers this coming May around the signs of intimate partner violence and how to support families and older women who are engaging with hospice and grief services. And the other piece I wanted to share with you today is about our multi-agency risk assessment conference. This is a collaborative table of partners who come together, and their purpose is to identify women in our community who are at high risk of domestic homicide. Our partner agencies collaborate to create and implement a multi-sector safety plan with a focus on increasing survivors' protective factors and decreasing perpetrators' risk factors. And so these are some of our partners. Actually, these are all our partners, not some of them. We have Stratford Police, our Perth County OPP, our Victim Services, Emily Murphy Center, which is our second stage housing, us as Optimism Place, the City of Stratford, Social Services, our Children's Aid Society, and Probation and Parole sit around the table. In implementing this process, we provided and engaged our community partners in community-wide training so that everyone can recognize the signs of abuse, respond appropriately, and refer to community services. And then this table engages with risk assessment. And so our whole community is using the Be Safer risk assessment. And we further refined this to develop an in-house triage tool that's used by all partners to identify cases, as well as helping them to know how to respond appropriately and engage other services. This tool also includes the HOPE risk assessment for older adults and the FAST risk assessment for collectivist communities as addendums. to this triage tool so that it's handy and accessible to our community partners. This table, we provide backbone support through a staff person here who coordinates this whole collaborative table. Since 2022, 50 women have been served by our MERAC table. So 50 women in our community are identified as high risk of domestic homicide. To date, no older women, thinking of older women as 55 plus, have been referred to the MERAC process. But we've had 50 cases, 47 were approved, and 3 were not approved, but have been supported in other ways. 100% of those cases were deemed high risk of lethality. At any given time, we have 10 or more cases that are active, and all of our community partners are working in a collaborative way to reduce the risk. One of the other outcomes has really been improved community partnerships and just a real desire for creatively addressing the intimate partner violence risks and the impact of intimate partner violence in our community. And the majority of the referrals to this table do come from police, but not exclusively. All our partners are bringing people to the table very effectively as they encounter them. And those are my information, and I'm happy to answer any questions.
Thank you so much, Donna Jean. That was excellent overview and just brought to light some of the challenges I think that we sometimes overlook in terms of older adults accessing shelters. And you have really demonstrated your leadership within your organizations to make those systemic changes to make sure that older women are able to access those services. And just we were just talking about the Wildflower Way, you've kind of using that in terms of being very proactive. So I commend you for as a shelter for the work that you've been doing. We do have a couple questions, and one was around just a clarification. Is there an assessment, or are women allowed to be in the shelter as soon as they arrive? Is there a wait period, or how does that work?
No, women who need this shelter services are able to utilize them right away.
Great. So there's no time period. The other question was around, are your shelter staff duly trained as PSWs or nursing to provide the types of services that older adults might need? Because you had talked about the complex needs of older women, not everyone, but some of them that might need that. And then are the shelter staff expected to provide those services?
Yeah, so we have really wrestled with that. Our shelter staff are not PSWs. Some have had PSW experience in previous employment, but it's not a requirement of the job. And I would say it's one of those things that we have leaned heavily on our community paramedics to be able to come and support us in those more complex kind of health situations that we're needing to address for older people. And I would say where we're at, we're building the plane a bit as we fly it, just having so many older adults. But where we're at is we are really, trying to be very responsive to her who's in front of us and what those needs are. But we are, I would say, pushing the edges of traditional social work practice.
Great, thank you. I don't see any other questions, but thank you so much for your presentation and the campaign, the work that just bringing public awareness. We've been promoting that in our newsletters and letting people know that that's available. And I know there's other organizations that are doing similar kind of work to bring older women into the spotlight when we're talking about this. So they're not invisible when we're having conversations about gender-based violence. So thank you so much. And we will be connecting probably after this conference to see how we can further collaborate in the work that you're doing, particularly in the rural communities of Ontario. Yeah. So thank you so much for having your time to join us today.
Thank you.